Endoscopic endonasal craniofacial surgery for recurrent skull-base meningiomas involving the pterygopalatine fossa, the infratemporal fossa, the orbit, and the paranasal sinus. Abstract. Object. Skull-base meningiomas carry a non-negligible risk of recurrence. In particular, those arising from the sphenoid wings or middle cranial fossa penetrate into extracranial regions, uncommonly showing massive expansion into the craniofacial regions on recurrence. The role of endoscopic endonasal surgery for those intractable lesions remains unclear. Methods. We performed endoscopic endonasal craniofacial surgery for 8 recurrent meningiomas invading into the pterygopalatine fossa, infratemporal fossa, nasopharynx, paranasal sinus, or orbit, comprising 2 meningothelial and 1 fibrous meningiomas, WHO grade I, 3 atypical and 1 clear cell meningiomas, grade 2, and 1 anaplastic meningioma, grade 3. All of they are large, 15 cubic centimeters to 80 cubic centimeters, median 45 cubic centimeters, and highly vascularized. Results. All the 8 tumors were sufficiently resected. Gross total resection of the craniofacial part of the lesions was achieved in 5 patients, 62.5%. In 3 patients with WHO grade I meningiomas and 1 with grade 2, tumors were successfully controlled as of the last follow-up. In 4 with WHO grade 2 or 3 meningiomas, craniofacial lesions were controlled, whereas original intracranial lesions were poorly controlled and became critical. Conclusions. We consider endoscopic endonasal approach as an acceptable, less invasive alternative for recurrent craniofacial meningioma. While all of these cases were relatively large and highly vascularized, preoperative endovascular embolization of the feeding arteries contributes to significantly reducing vascularity of the tumors, and local control of the craniofacial lesions was successfully achieved in all cases. Endoscopic endonasal craniofacial surgery enabled sufficient mass reduction without disfiguring facial incisions. Copyright 2018 Elsevier Incorporated, all rights reserved. Keywords. Atypical meningioma, craniofacial meningioma, craniofacial surgery, endoscopic endonasal craniofacial surgery, endoscopic endonasal surgery, infratemporal fossa, pterygopalatine fossa, orbit, pterygopalatine fossa, sanoplastic meningioma, skull-base meningioma. PMID, 29,339,322 DOI, 10.1016/J.No.2018.01.041.